Many seniors believe more testing means more safety, but the reality is not always so simple. Overtesting can lead to unnecessary stress, risky procedures, and even worse health outcomes. By understanding which tests are truly needed, you can protect your health and avoid needless harm. Remember, staying healthy isn't about more tests, it's about smarter choices. Let's begin with one of the most common checkups that often brings more risks than benefits after 60. Annual full body scans sound thorough, but they expose seniors to high radiation levels. This radiation, when accumulated over years, can actually increase cancer risk instead of preventing it. Studies show that seniors receiving frequent scans often end up with false positives. False positives lead to invasive biopsies or surgeries that carry significant risks for older adults. Imagine preparing for surgery only to discover later it was unnecessary. One 64-year-old patient underwent lung surgery after a false alarm, leading to long recovery and breathing issues. Doctors now recommend body scans only when symptoms clearly point to a problem. Instead of yearly scans, ask for targeted imaging when you and your doctor see a real reason. That way you avoid radiation overload while still staying safe. Another test often misused after 60 is the colonoscopy. Colonoscopies can be life-saving before age 60, but beyond that, the balance shifts. Seniors face higher risks of perforation, bleeding, and complications from sedation. One study showed complication rates doubled in adults over 65. The risk may outweigh the benefit when cancer growth is much slower in older age. We knew a 68-year-old who developed internal bleeding after what was meant to be a routine colonoscopy. Instead of colonoscopies, doctors often recommend less invasive stool tests after 60. These alternatives are safe, effective, and easier to tolerate. Always discuss with your physician whether the procedure is worth the risk. Sometimes, less is truly more for your health. Now let's move to prostate cancer screening, especially controversial for men over 60. PSA blood tests often show elevated levels even without real cancer. These false alarms can cause unnecessary biopsies and anxiety. Prostate biopsies carry risks like infection, bleeding, and urinary problems. In many older men, detected cancers grow so slowly that they never cause harm. One 62-year-old man underwent surgery for prostate cancer and ended up incontinent for life. His doctors later admitted the cancer was so slow-growing, he likely never needed treatment. That's why major health organizations now advise against routine PSA testing after 60. For most seniors, careful monitoring is safer than aggressive screening. This prevents the cascade of worry and risky treatments from harmless findings. Mammograms are another test to reconsider after 60. While effective in middle age, mammograms past 60 may bring more harm. Older women face higher chances of false positives leading to biopsies. The stress, radiation, and follow-up procedures may outweigh benefits at this age. A 65-year-old patient received repeated mammograms showing suspicious spots, none of which were cancer. The repeated procedures left her anxious and bruised, with no health improvement. Guidelines suggest mammograms may not be necessary after 64 unless there are strong risk factors. Instead of yearly mammograms, discuss individual risks with your doctor. Sometimes, stopping unnecessary screening brings peace of mind and safety. Next, let's consider bone density scans, often overused in seniors. Bone density tests help detect osteoporosis, but repeated scans add little value after 60. Bones don't change quickly, so testing every year is unnecessary. A patient named Eleanor had 5 scans in 7 years, each showing the same mild thinning. She ended up stressed and confused, thinking her condition was worsening. Doctors now say scans every 5 years, or even stopping after stable results, makes more sense. Fewer scans mean fewer worries without missing important changes. Annual EKGs are another example of questionable testing. Without symptoms, routine EKGs rarely help seniors over 60. They often detect harmless irregularities that lead to more invasive testing. One senior had a pacemaker implanted after a questionable EKG result, though he felt fine. That surgery left him with complications he never needed to face. Experts recommend only doing EKGs if you have chest pain, palpitations, or shortness of breath. Otherwise, routine heart monitoring can cause more harm than good. Simple lifestyle measures like exercise and diet often protect the heart more effectively. Next, we must talk about routine chest X-rays. Decades ago, chest X-rays were a standard part of annual checkups. But for seniors today, they offer little benefit without clear symptoms. X-rays often reveal shadows or spots that turn out harmless, yet they lead to CT scans, biopsies, and sometimes even unnecessary surgery. A patient in her 60s underwent lung surgery after such a false finding, only to learn nothing was wrong. Instead of routine X-rays, focus on reporting new symptoms like coughs or chest pain quickly. Another overused test is thyroid screening. Many seniors are tested yearly, even without symptoms. But mild thyroid changes are extremely common with age and often harmless. These minor findings often lead to lifelong medications seniors don't really need. We saw this with a 61-year-old man who started thyroid pills after borderline results. Soon he was battling fatigue and side effects, all from unnecessary treatment. Most guidelines say thyroid testing should only be done when clear symptoms appear. Otherwise, it may cause more trouble than benefit. Let's recap. Routine scans, colonoscopies, PSA tests, mammograms, bone scans, EKGs, chest X-rays, and thyroid checks can all be risky when overused after 60. Each of these has its place, but not as routine yearly checkups for all seniors. Instead, tests should be tailored to your personal history and symptoms. That approach prevents harm while still protecting your health. Many seniors find peace and confidence when they understand this. Avoiding unnecessary tests means fewer hospital visits and fewer scares. It also means more time enjoying life rather than sitting in waiting rooms. The goal is not to fear tests, but to use them wisely. When you and your doctor make decisions together, you reduce risks and stress. Seniors often say they feel more in control once they understand their real needs. That's the power of knowledge. It keeps you safer than routine checklists ever could. Imagine living with less anxiety and fewer procedures. Imagine focusing on feeling strong, moving freely, and enjoying family instead of endless tests. This is possible when you prioritize the right choices. The best way to stay healthy after 60 isn't more testing, but better living. Focus on proven habits like eating well, exercising, and sleeping deeply. These daily routines often protect health better than unnecessary checkups. Studies confirm lifestyle has a far greater impact than most screenings at this age. Seniors who walk daily and eat balanced meals often avoid major illnesses. Simple steps create lifelong strength and resilience. You don't need to chase every test to stay healthy. What you truly need is balance, knowledge, and mindful care. Always question, will this test change my treatment? If not, it may not be worth the risk. This single question can save you from unnecessary harm. Remember, you deserve quality, not quantity, in your healthcare. Aging well is about confidence and control, not endless worry. The fewer unnecessary tests you take, the safer and freer you feel. Instead of chasing more checkups, invest in preventive habits. Fresh food, daily movement, and meaningful social connections keep you thriving. These things bring more life to your years than any unnecessary scan. Trust yourself and work closely with your doctor for choices that truly matter. That partnership is your strongest tool for aging with dignity and strength. Thank you for watching and being part of our Golden Years Wisdom community. Stay smart, stay strong, and remember, health after 60 is not about doing more, but doing what matters most.